The health insurance for older people was introduced by Law No. 3323, enacted on the 16th of January 2006. It gives people over the age of 60 who don't have any other form of health insurance the right to receive free medical care. Under an agreement with HelpAge International in Bolivia, the Horizontes Foundation has carried out the project Older Citizen Monitors, Social Oversight of the Health Insurance for Older People. The project was funded by World Granny and ran from June 2008 to July 2011. The aim of the Older Citizens Monitoring Groups is to help to improve the implementation of the health insurance for older people in municipalities and health services, and thus empower older people's organizations.
Desde la creación de la ley 3323 del SPAM en el año 2006, prácticamente los municipios han empezado a tomar a su cargo la atención del seguro de salud para el adulto mayor, con un presupuesto que procede desde los recursos captados en el IDH y que llega de acuerdo al número de afiliados que tiene cada municipio.
The work was done in several phases. Organization phase. In compliance with Law 3323, groups of 10 older people were set up in 5 cities: Tarija, Sucre, Potosí, La Paz and El Alto. The members of the groups came from the organizations that belong to the National Association of Older People in Bolivia, ANAMBO.
Los grupos de control social están conformados por la ciudad de La Paz, que son 10, en El Alto 10 y que han engrosado a 40. En la ciudad de Tarija tenemos 10, se mantienen las 10 personas. En la ciudad de Sucre éramos 15, abandonaron 4, de las cuales quedaron 11. Y en la ciudad de Potosí, que son 10, y también abandonaron 4 y quedaron 6.
Training phase. Older people were given training on Law 3323, covering self-esteem, organisation, communication, intercultural family and community health, leadership and how to fill in the form for visits to health facilities, using appropriate methods in the older people's own language, to enable people to find out about the new law so that they can exercise their right to health and receive non-discriminatory treatment in health facilities. Animation, information sharing and evaluation techniques were used. Publicity phase. Radio spots and an information video were produced by the groups of older people in Aymara, Quechua and Spanish to tell the public about Law 3323 and the citizen monitoring work. All the publicity was supported by printed materials.
Hemos difundido nuestro trabajo en diferentes lugares. Para empezar, hemos hecho spot. Hemos visitado los diferentes medios de comunicación como radio, televisión, periódicos para difundirlo. También hemos visitado a diferentes pueblos, diremos así, lugares donde hay una mayor cantidad de abuelitos, adultos mayores, para hacerles conocer esta ley 3323 que ampara y nos asegura con la salud para todos nosotros.
Citizen Monitoring Phase. Chapter 6, Article 25 of Law 3323 says that civil society institutions, the Municipal Oversight Committee and groups of older people shall be made aware of, monitor and evaluate the results of the application of the health insurance for older people and have access to information about the management of the insurance. In compliance with the law, the older people in the citizen monitoring groups make frequent visits to health facilities that provide services under the health insurance for older people to gather information about the difficulties involved in implementing this health insurance and then find a solution in meetings they hold with municipal government officials.
El Hospital de Clínicas de la Ciudad de La Paz es un hospital de tercer nivel que brinda atención a todos los tipos de pacientes que vienen. Se ha estado realizando un control por parte de los mismos adultos mayores que son los que asisten a estos pacientes, vienen, les hacen unas entrevistas. Es un control óptimo el que se realiza, ya que son adultos mayores que controlan a otros adultos mayores. Si bien estos son, la mayoría de estos pacientes pueden ser en algún momento discapacitados o tienen un lenguaje propio o las características propias del adulto mayor se ven más identificados cuando otro adulto mayor los visita y les pregunta acerca de la atención y de la calidad que se les está brindando en el hospital.
Some of the project's most important results are: health authorities acknowledge the work of the older citizen monitors. Health staff are providing better treatment and care. Older people have been empowered to exercise citizen monitoring. Health authorities participate actively in meetings with the older citizen monitors. Training techniques and methodologies have been developed for older people. The Horizontes Foundation has provided advice to the institutions responsible for the health insurance for older people. The citizen monitoring work is coordinated with municipal governments.
Ha mejorado la calidad de atención médica de nuestros adultos mayores gracias al apoyo del grupo de control social, porque ellos han estado constantemente yendo a hacer seguimiento. Por ejemplo, yo les voy a contar del Hospital Santa Bárbara. Ellos han creado un departamento que es netamente para el adulto mayor. Entonces ahí, por ejemplo, tienen 2 trabajadoras sociales, donde las trabajadoras sociales van a sacar ficha. Nuestros adultos mayores ya no tienen que caminar, peregrinar de un lado a otro lado. Entonces también esto ha sido con apoyo a nuestros adultos mayores de control social.
All this work done by the Horizontes Foundation, thanks to the support provided by World Granny, has brought about improvements in the quality of care in health services to the benefit of all older people.